Diabetes is a chronic medical condition that affects millions of people around the world. As a nursing student, it's essential to understand the signs and symptoms of diabetes, the different types of diabetes, the risk factors, age groups, and demographics of the condition, and how to perform a nursing assessment to identify the condition. In this video, we'll cover all the basics of diabetes, including nursing assessment of extremities. Let's start with the signs and symptoms of diabetes. As a nurse, you should assess for the following signs and symptoms: increased thirst and frequent urination, fatigue, blurred vision, slow healing wounds or sores, unexplained weight loss. If your patient presents with any of these symptoms, it's essential to perform further assessments and consult a healthcare provider. There are three main types of diabetes. Type 1 diabetes. This type of diabetes occurs when the immune system attacks and destroys the insulin-producing cells in the pancreas, leading to a lack of insulin production in the body. It is most commonly diagnosed in children and young adults. Type 2 diabetes. This type of diabetes occurs when the body becomes resistant to insulin or doesn't produce enough insulin to regulate blood sugar levels. It is most commonly diagnosed in adults, but the incidence among children and adolescents is increasing. Type 2 diabetes is the most common type of diabetes and occurs when the body becomes resistant to insulin or doesn't produce enough insulin to regulate blood sugar levels. While it is most commonly diagnosed in adults, it can also affect children and adolescents, and its incidence in these age groups is increasing. This type of diabetes is closely linked to lifestyle factors such as a lack of physical activity, an unhealthy diet, and obesity. In fact, obesity is a significant risk factor for type 2 diabetes, with approximately 90% of people with this type of diabetes being overweight or obese. It is essential for nursing students to understand the impact of age and obesity on the development of type 2 diabetes. By promoting healthy lifestyle habits and encouraging weight management, nursing professionals can play a critical role in preventing and managing type 2 diabetes in patients across all age groups. Gestational diabetes. This type of diabetes occurs during pregnancy and usually resolves after delivery. However, women with gestational diabetes are at higher risk of developing type 2 diabetes later in life. There are also several risk factors for diabetes, including obesity, family history, physical inactivity, race/ethnicity, and age. As a nurse, you can perform a nursing assessment to identify diabetes. This assessment should include the following: assessing for symptoms of hyperglycemia and hypoglycemia, checking blood glucose levels, assessing for diabetic complications such as foot ulcers, vision changes, kidney disease, and nerve damage, assessing extremities for any signs of peripheral neuropathy or vascular disease. To assess extremities, you should look for the following signs: decreased or absent sensation, tingling or burning sensations, muscle weakness, poor circulation, as evidenced by cool or discolored skin or slow healing wounds. Abnormal findings in nursing assessment of extremities include peripheral neuropathy, which can result in decreased or absent sensation, tingling or burning sensations, and muscle weakness. Peripheral vascular disease, which can result in cool or discolored skin, slow healing wounds, and poor circulation. Diabetic foot ulcers, which are common in patients with diabetes and can lead to serious complications, such as infections and amputations. As a nurse, it's essential to perform regular assessments of extremities in patients with diabetes and report any abnormal findings to the healthcare provider. Now let's talk about glucose and A1C ranges. As a nurse, it's essential to monitor your patient's glucose levels and A1C to ensure they are within target ranges. A normal glucose range for a non-diabetic person is between 70 to 99 mg/dl, and a target glucose range for a person with diabetes is between 80 to 130 mg/dl before meals and less than 180 mg per deciliter after meals. The A1C test measures a person's average blood glucose levels over the past 2 to 3 months. A normal A1C level for a non-diabetic person is less than 5.7%. For a person with diabetes, a target A1C level is less than 7%. Abnormal glucose and A1C levels can indicate poor blood sugar control and an increased risk of complications such as cardiovascular disease, kidney disease, and neuropathy. In conclusion, as a nursing student, it's crucial to understand the signs and symptoms, types, risk factors, age groups, and demographics of diabetes. You should also know how to perform a nursing assessment to identify the condition and assess extremities for any abnormal findings. Regular monitoring of glucose and A1C levels is essential to ensure optimal blood sugar control and prevent complications. Remember to consult with a healthcare provider if you suspect your patient has diabetes or presents with any symptoms. With this knowledge, you can provide effective care and support for patients with diabetes. Thank you for watching, and we wish you all the best in your nursing studies.